one field or one topic that's really causing confusion under many people, it's the depth of field.
Yes.
That in combination with the f-stop, in combination with the aperture, these are all terms.
Yes.
Depth of field, aperture, f-stop, at this point you lost many people.
Yeah.
So why don't you explain it to me?
Okay.
You can see in this photo here on the slide that some parts are blurry and some parts are sharp.
Right, and those are mushrooms in my garden, by the way. I took a picture of, and that is correct. So as far as
nice mushrooms.
Those are actually mushrooms, yes. Yeah. I think Ascomycetes. Had a few years of botany back in the day. But as far as the setting goes, I wanted it to be blurry like that, like a portrait. So all you need to know is you think of the lower numbers like f5 or 5.6, somewhere there, if you don't want if you don't want to see front to back, and a higher number if you do.
Yeah. So if you have, for example, in this photo, you can see these two soccer players.
That's right.
that are running and they are sharp in focus, but you see the background blurry.
It's blurry. That is correct.
And you want to focus. You want to focus on the two soccer players. You don't want to focus on the background. So it gives you a little bit of dimension.
Exactly.
In the photo.
Exactly.
Where you don't want to have dimensions is in dental photography.
Very, very good. Obviously, in this type of picture, the goal would be this is a retracted anterior picture, and you viewers can see on your right, as you go posterior, you can see it get blurry, and you can see the one on the left. It's in focus from front to back, and that's to do two things. Okay, one is going to be the f-stop, as we said. A higher number is better, like f32. But what is also important is the focus point. Where is it from front to back do you focus? And you want to take advantage of your depth of field. So your focus point is going to be about halfway back. And I think there's other slides later
we're
going to
talk about where we're going to focus on little tips and tricks that you put together.
But this is a good example of that.
The depth of field. So if you take a photo, for example, and you send this to a doctor, let's say it's a case you did in front of the mouth, or you want to send this one to the AECD, they wouldn't like it because you don't see the background, and the doctor doesn't see the beautiful crowns you did in the back, for example.
That's correct.
Because they are blurry. So in this photo, you increase the f-stop, you made it f32, 29.
Exactly.
You just made a higher number and you compensated for this one so that it's not blurry anymore.
Yeah, f-stop along with where the focus point is. And those are the little technique things as you take your courses, or you'll see a few slides a little bit later on, that you'll see focus, where you're focusing is equally as important. So combine is a technique thing, but exactly.
And if you go on manual mode, many doctors, they get the camera and they get frustrated, and what do? They put it on auto.
Oh boy.
On auto. On the green little A, everybody knows, on the dial, on the dial mode. And what does it do, the auto mode? So the camera wants to get the best picture possible. They want to get as much light as possible into the sensor. So what does the camera do? Is open the aperture up, let as much light in as possible. And but what does it do?
It's not so good.
It's not so good because you're creating a low f-stop, and you're creating small depth of field.
Exactly.
So you have your background blurry, and you always see this in dental photos.
Right. But still a lot of disappointment because you're not getting what you want.
Exactly.
So don't set your mode into auto. You know, follow Karsten's settings, and you'll be much better off.
It's really good, yeah.
Okay.